Ma'am, should I start?
Yes.
Good morning to one and all present over here. Honorable guest, Dr. Neeta Mahesekar, ma'am, our respected principal, Dr. Ujwala Shinde, ma'am, and all the dignitaries present over here, I would like to welcome you all for this event. One day national workshop for girls students under Nirbhay Kanya Abhiyan. Hi everyone, I'm Afsana Khatun and my friend Diksha Singhi, student of BA LLB first year, are the host for today's program. Now, I would like to call my co-host Diksha Sinde to introduce the program.
बालिका अहम बालिका नवयुग जनिता अहम बालिका नाहम बला दुर्बला आदि शक्ति अहम्बिका. I am a girl of modern times. I am not feeble or powerless. I am Adi Shakti. I am Ambika. Nirbhay Kanya Abhiyan scheme is introduced by the Savitribai Phule Pune University to develop the self-confidence and personality of girl students who comes from all the stratas and areas of the society. The main objective of the scheme is to develop a critical minds and self-confidence and a commitment to the society. Now, I would like to request our principal ma'am, Dr. Ujwala Shinde, to welcome our honorable guest.
Thank you. Thank you very much. And good morning.
Good morning, ma'am.
Yeah. Please share the link with ACS College also. They are asking that link has not been shared with them. Ask Ajay sir. Okay. Yeah. So good morning all. And I welcome Dr. Neeta Mahesekar to her own institute. So she was previously belonging to this institute, I came to know. And on behalf of Dr. D.Y. Patil Unitech Societies, Dr. D.Y. Patil Law College, I welcome all the students, girl students, and Dr. Neeta for today's Nirbhay Kanya Abhiyan and Menstrual Hygiene program. Regarding this women and health and menstrual hygiene program, this is very important and it is very close to our heart, but still it is ignored. Though we think that it is important, we never ask questions about this. I can say that girls are very keen about the beauty tips, but they are not at all interested. I can say that they are just hesitating to ask the questions on this menstrual hygiene, which is very important in their life, in our life. So I guess this is the platform that they can ask their doubts and they can clear their doubts and proceed further. So I thank you all for giving me an opportunity to welcome Dr. Neeta. Thank you.
Thank you, ma'am, for your valuable words. Now, I would like to call co-host Diksha to introduce our guest.
It's indeed an honor to introduce today's guest, Dr. Neeta Mahesekar ma'am. The world is full of diamonds and we are having some of them. Here today we have Dr. Neeta Mahesekar ma'am. Dr. Neeta Mahesekar ma'am has completed her MD education from NTR University of Health Sciences, Vijayawada, and she completed her PhD from MUHS Nashik on topic indigenous medicine on ovulation. She completed her PG diploma in clinical research and regulatory affairs affiliated to University of Birmingham. She has vast experience of 29 years in academics and she has served as HOD and professor. She is currently director in Northeast Institute of Ayurveda and Homoeopathy, Shillong, Meghalaya. Madam has published research papers in national and international journals. She has contributed a chapter for a book on female infertility published by Ayush Darpan Foundation in January 2021. She is also an author of a book on Ayurvedic solutions to Yogi Vapat female disorder. She is and has been a member of various boards and committees like member of Ayush Committee for Ayurvedic Syllabus Revival at Bangalore, member of Review Board of Ayu International Journal, member of Advisory Board and ISAM 2013. She has delivered lectures as a guest speaker at various renowned institutions and conclaves. We are lucky to have you here, ma'am. Thank you very much, ma'am, for gracing this occasion in spite of your busy schedule. Now, without wasting any time, I would like to call upon our guest to start with the session.
Good morning, all. Do I start now?
Good morning, ma'am.
Can I start? Okay. Namaskar to all. Initially, right, I'm from the Faculty of Ayurveda. So, Om Sri Dhanvantaraya Namaha. I would like to pay my respects to my gurus, my parents, and definitely, initially, it is my habit to, word of thanks is at the last, but I would like to pay my respect to Dr. D.Y. Patil College, Principal Madam here, Shinde Madam, and my institute where I had served. This is my first lecture after I have taken charge as a director at Shillong. So, ma'am, thank you for that. And definitely, this is a good thing that my first passion was teaching, of course, and interacting with girl students, making them strong. As I just heard, the Adi Shakti, the Amba, everything, the whole of the patience God has given to women, of course. But then how do we care? As now today's topic, women's health, the menstrual hygiene, this will lead to your later life to be more healthier as a woman. Then only once your health is good, then only you can be definitely progressive in all respects. So this is my conviction. I would like to share my screen with my PPT. So just give me a minute. Is my screen visible? May I know?
Yes, ma'am.
Okay, okay. Yeah. I'm sorry, it was at the end. So again, after giving my respects to the management of D.Y. Patil, Smita Didi, where I worked under, and Bhageshri Tai, P.D. Patil sir, and all of the staff there. Thank you so much. Here, now we start with women's health. See now, women are the most beautiful creation of God. Do we agree? Yes, definitely. Because now here you see, most of the girl students, the young students here can identify Aishwarya Rai and Vidya Balan. Okay, but I would like to tell you, every woman is a heroine in her own life. Look at this, and look at this. Everyone. So why I say this? Because they have chosen their career in the glamour world, we can identify them. Everybody identifies. But when you're in your own life, beauty is in the health, in your skin, how you maintain your hair, and every whole thing in Ayurveda, we say Sukha Ayu, Hita Ayu, Swastha Yukta Ayu is only, Ayu means life, not only the age, it is the life, how you create your own life by particularly maintaining not only the physical health. See, the happiness comes with the mental health also. So Ayurveda is contributory in telling, now the whole world is accepting that definitely. I see Dr. I think I've seen Vanita madam here. Thank you, Vanita madam. I'm interrupting, I'm sorry, but I've seen her on the screen, on the sideline, and therefore I thank her, she has contacted me. So here we come back. In the beauty of the women, it is not only the physical health, but the mental health. So we know, however exercise you do, the mental health contributes. So again, first point, second basic principle of Ayurveda, how do we maintain the physical and mental health? It is by the exercise, by the routine of women's work, and by the mental attitude, by being happy. So everybody, then you may say, we have so many problems, how to be happy? Patience. So this is what has been in Indian culture right from ancient period. The women is an icon, the symbol of patience. So nowadays we lack patience because we are stressed out, we are working outside and we think we are doing something great. It is not at all like that. You see these women, they do work so hard, see the happiness and the contentment on their face. This is what is to be learned in today's world. And nowadays we see so many anxious cases, depression cases, and all these are contributory factors because we lost patience. And patience is what is taught in household, not in science. We are going to educational institutions, we are thinking that is very much important. But I'm talking about the mental health, which is really very much important. Satisfaction, contentment, agreeing to what you are getting, acceptance. These are the things which are kept to the mind so that we do not suffer. And once you suffer on the mental level, you don't feel like eating properly, sleeping properly. These two things disturb, sleep and diet. Once this disturbs, the metabolism, what is metabolism? We all know by now. You all are 12th standard passed students. So even if you're not science students, I understand whatever you eat, the bioavailability of the diet to the system, to the tissues, the circulation, and the maintenance of health is maintained by your diet and proper sleep. These two things cannot be compromised, and the contentment and happiness and acceptance. I wish you all take this as a blueprint in your mind that mental health carries a very big importance. It is highly significant in Ayurveda. It has been explained, not only Sharirik Swasthya, Manasik Swasthya bhi utna hi important hai. Now, what is speciality of a woman? A woman, by executing her duties, she's dispensing in, she's a multitasker. We all know, we all have seen our mothers doing their duties, our teachers doing their duties, and outside world, now we have Shivani Singh, we have Seema Rastogi, the SP. So in all spheres, the Rafael by Shivani Singh and everything now, you all, every woman is in the news. So here, the main thing is the motherhood. Main thing why I say, basically most of the women, their beauty, everything lies not only because we are not everyone is in the glamour world. Nowadays, beauty is understood by how you look, how you present. But as a health person, I understand and want to give this message to the world. Beauty is in health, in physical and mental health. So women is special, but to be a mother, you are too young now, 12th class. I understood my audience is from 12th class to graduates and postgraduates. So the younger female students can understand puberty, menarche, and menstruation. But for the later life, slowly it is a stepwise progression towards womanhood, towards motherhood. So that is the reality of life we have to accept. And therefore, you understand the system. how much you can absorb. The 12th class past first year students can absorb and maintain their health likewise, and the rest of the students who have graduated, slowly they will be stepping into motherhood. So there should be insight into how you maintain your hygiene, your mental health, your physical health, and overall health. So here, in short, I won't go into detail. The female reproductive system, it is in the pelvic region. In this part, you see this is the uterus, the cervix, and opening into the vagina. Here is where the infections take place because of your clothing, because of your health, everything. So here, hygiene represents there should not be irritation, itching, white discharge. Otherwise, your mental health suffers. There is something happening to me. And these infections, they lead to cervical problems. The uterus has a body and a cervix. So this is where in future life, because of these minor irritations, not in all, only in few, if the body autoimmune system is weak and the infection is great, and that time you feel the cervix suffers, there is infertility and there are issues with cancer-like things. So do not keep this in mind that once there is white discharge, there is cancer. Again, this is what I told. Leave anxiety out. You have to work out for maintenance of the body, but do not keep negative things. As we are getting educated, definitely with Google, with so many things available nowadays, with social media being very strong, immediately you read, and whatever the acceptance is there in the mind, whatever you have thought, suddenly your fears increase. Please do not do that. Do go to a proper person who can help you out. I mean the medical personnel who can help you out. So here, I just be mindful. If there is any infection, if there is any discharge, you should be mindful because this can lead to cancer here. And here, one benefit is in women that even if there is a cancerous thing in this part, definitely you can remove it and you can sustain with life. So that is one advantage. This is an extra organ, which is an important organ of menstruation and childbirth. But it also can be removed in case it is not required after completion of the family. Now here are the ovaries. So nowadays people mostly have been listening about polycystic ovarian syndrome. So here is where these changes occur. Now this is the body of the uterus where the child is going to be, the pregnancy occurs here and the fetus sustains here. These are the fallopian tubes, again important part, which are good. When they are good enough, there is no infertility. Their health is also important. The ovum is generated here. Beej jo nikalta hai, yahan se niklega, and it is carried. Fertilization occurs here and pregnancy occurs here. But the menstruation occurs here. Now what does menstruation do? Every month there is menstruation, and this menstruation is going to help for maintenance of the endometrium, which is shedding out every month as bleed and mucus and clots. And this is what is a preparation of motherhood. So from puberty, around 12 years, now the age has come down somewhere from 10 years, the girls are menstruating. It is a very harsh thing because there are some changes occurring during puberty, which is going to affect the mental health if the girl is emotionally not that strong. So nowadays, even the schools are educating the girls as to what is going to happen in future along with puberty. So let's understand the basic. By now, all the girl students know it is a major part of difference, fundamental difference between men and women. We are physically different. Okay, we have to accept that. People say no, men, women are equally same. No, we cannot say that we are more smarter or we are more weaker. You cannot judge that way because women are ahead nowadays in every sphere. But I would like you to understand physically we are different, and Here, why? Because women bleed. We have a system you have seen just now. The collection occurs here, and there is a bleeding like this every month. So somehow magically, usually like clockwork, once in a month from puberty, that is the age group I told you, it was 12 initially. Menses would start at 12, but nowadays it is as early as 10. I would always advise all the mothers to refrain kids from watching much of adult material on the television. Slowly, the hormones work out. The material, what they are seeing in the mobiles, the books, what they are seeing, and whatever visualization, slowly the impact is on the brain. There are few parts, I won't go scientifically, and the hormones start developing. And that is how the puberty is coming faster. The secondary sexual characteristics along with the puberty comes faster. The pubic hair, the axillary hair, the breast changes, and suddenly few of the girls, they go into a shell because they cannot adjust with these changes. And the menstruation, of course, it is a pathetic thing that they have to adjust with the sanitary napkins, the carrying, and the fear that some spot may be there. So all these conditions, the maturity should come a bit later, that is 12 years. The diet is also an important factor here that is going to affect for early puberty. So puberty expected at 12, now it is at 10, and menopause is expected at 50 as per Ayurveda. And allopathy also, the other conventional sides of the pathies. But nowadays, menopause is as early as 35 sometimes, 32 sometimes. And as a doctor, we feel very much what we cannot help at that moment. So the girl students who are listening to me today should be very mindful how they carry their life from puberty till menopause. जितना लेट मेनोपॉज होगा उतने आपके बोन्स स्ट्रॉन्गर रहेंगे क्योंकि the hormones are helping to maintain calcium levels in the body. So it is a boon. In fact, the menstruation is a boon, in fact, where women suffer less heart attacks because there is an outlet. Every month, whatever metabolites are retained in the body, they have an outlet as compared to the men. So we are different from men, and men do not have an outlet. Therefore, the pressure, the metabolites, they clog in the body, and that is how most of the cardiovascular system disorders, that is heart attacks, occur in men, and women have this advantage, and therefore we have to maintain in order to retain the calcium levels. India is a tropical country. We have so much of sunshine here. So we should take advantage of going into the sun. Again, I told you we are not in the glamour world. My skin will tan. I will not look beautiful. No, my dear friends, your sunlight is going to help. You're taking calcium tablets instead. Why you want to take ready-made when the body can produce itself? And that is more advantageous rather than the external pills what people pop up after 30, coming into 30s. So be mindful how you maintain your diet, how you maintain your health from puberty to menopause. The menopause should be as late as can be. Okay, so this is how my message will be. So in order to maintain this, we need to go on with few of the steps, few of the healthy things which I'm going to give as I progress in my lecture. Menstruation is also known as a menses. In mammals, it occurs. We all know, we have learned that it is coming down from the vagina for 4 days slowly. God has made a sheet which has a corrugated sheet-like thing, where a sieve-like thing, wherein the menses, suddenly if it comes, you cannot do your routine work. Slowly by slowly, the menstrual blood, it comes in a span of 4 days, 5 days, or 6 to maximum 7 days is the limit. So a normal menstrual cycle can anywhere between 4 days till 7th day is a normal thing. Okay. Now the period duration is once in 28 days is ideal. Few people may have 30 days cycle. Few may have as early as 24 days cycle or 35 days cycle. Here we should be mindful, the girls who are getting menses once in 28 days, and if it continues the same is fine. But once in 28 days, once in 35 days, the next cycle is 45 days, then definitely you should go to a doctor. Your health will suffer in case this does not occur. So you should be mindful. There should not be any irregularity of the duration of menses period and the bleeding period also. As I said, if you're bleeding for 4 days, yes, you should be bleeding. Sometimes 4 days, sometimes 2 days, sometimes 7 days is not good with your health. You have to see a doctor then. You may be anemic, you may be having less of the iron. So here in our society, most of Western societies, menstruation has been given a bad name also, often being the subject of strict taboo, shame and revulsion, again, which is wrong. You have to interact very freely. See now, what happened? There were times where joint families were there. The grandmother, the aunt, everybody were together and a ready advice would be there. With nuclear families, people moving out to the cities and a working mother, you have these inhibitions. Sometimes you are shy, so you have to come out of that inhibition. The society has changed with nuclear families. I'm really sorry to say you don't get that advantage and that boldness to interact with another woman who is easily available with you. And that is again an issue with today's society. You have to interact very fast. I'm only happy that nowadays schools take up this point. Now today your institute has taken up this point for interaction and for understanding of menstrual hygiene. Now, menarche we know we have discussed from 8 to 16. Now, only one point is if the girl doesn't get period by 16 years, definitely a gynecologist has to be consulted because that is the time which we have already discussed, the 12 years of puberty has crossed. There may be hormonal issue, there may be issue with the diet, there may be issue with the gonads, that is ovaries. We have to look out if some help can be there, which medical assistance can help you over there. As early as possible, you have to go with that. So puberty, what happens during puberty? The hormones awaken and signal your body to go into puberty changes. So this is how we have discussed about the changes, what secondary sexual characteristics which arise with these hormones. So these are associated with the puberty. Timing, we have already discussed different times and last for different periods for everyone. Every individual is different. So it can start as early as 8 years of age. So this is a pathetic thing, what I have discussed, and as late as 13 years. See, can you understand? In a lifespan, a woman menstruates for 400 times, roughly. If this starts early and with education completion by 28, 30, and at that time there is a marriage and people going for motherhood, then the declining state of the hormones and the reserve of ovary is getting exhausted. That is the concern in today's world now in the society. The sequence of puberty from breast development to complete physical maturation may take a year and a half, as long as 6 years also sometimes. These events already finished. We will not go into it. Now, what are premenstrual symptoms? Here, the premenstrual symptoms are slow abdominal cramps, low back ache. So here there is bloating. Bloating means you will find some sounds, heaviness in the stomach is bloated. There is slow pain in the legs and the thighs. Slow mental changes occur in the woman. The girl finds herself reacting very sharply to anything told to her. So irritation, sometimes depression, they go into a shell, slow, not interacting anyone. What is happening to my body, they may think. So this is all you have to help out your other personnel along with you. Now you have had the insight into this point. You should be able to interact and let them come out of all these things. Lack of concentration. The hormones play havoc in the mind. The adulthood coming inside the body and lack of concentration. This is where you have to have control and pause into your mind that what best is for your mental, physical health. Do not go haywire. Definitely you will get carried away by the literature, sometimes into wrong habits, sometimes into wrong literature, wrong friends. So you have to be mindful at this point. This is the turning point of your life between 16 to 18 also. This is where the mental health suffers, and Ayurveda always concentrates. So I would like you to be very poised and lessening your irritability as it comes to you. It is by abhyas. अभ्यास यानी आप बार बार उसी चीज को पढ़ते हो. तो एक फॉरेन लैंग्वेज हम आज इंटरैक्ट कर रहे हैं, हिंदी में इंटरैक्ट करते हो, मराठी में इंटरैक्ट करते हो, बाकी सब भाषा को हम लोग इंटरैक्ट कर सकते हैं. यानी अभ्यास से हम जो बार बार एक्सरसाइज करते हैं, बॉडी इंटरैक्ट. सो हियर लैक ऑफ कंसंट्रेशन होना ही नहीं चाहिए. बी स्ट्रांग मेंटली. जैसे आपका कंसंट्रेशन रहेगा, आपका डिप्रेशन भी नहीं होगा, इरिटेशन भी नहीं होगा, और शार्प रिएक्शन बिल्कुल भी मत दीजिए. आजकल आई कैन डू व्हाट आई वांट बिकॉज आई एम ए अडल्ट. रॉन्ग नोशन है ये, बिकॉज वी आर गोइंग इनटू वेस्टर्न कल्चर मोर. I do not say Western is not a good culture. Even there, Victorian culture is there, wherein you are to adhere to some morals. But as Indians, in the name of modernization, we are suffering on this point. Definitely do not get carried away. So maintain your concentration, less of irritation and depression. So this exercise, if you follow, irritation आया, उसको वापस भेज दिया, आपने कहा no, I should be cool and calm. Definitely this will help. तो जैसे हमने एक फॉरेन लैंग्वेज को खारिज किया, उसी तरीके से हम इस कंसंट्रेशन को भी अपना डेवलप करके यू कैन फोकस ऑन स्टडीज, यू कैन फोकस ऑन योर करियर, यू कैन फोकस ऑन बीइंग अ गुड ह्यूमन बीइंग. व्हाई आई से गुड ह्यूमन बीइंग? बिकॉज नाउ इन टुडेज कटथ्रोट कॉम्पिटिटिव वर्ल्ड, एवरीथिंग यू वांट टू बी फर्स्ट. So nothing, there is nothing like first and last. You can be a good human being, focus and move ahead, accept what you get, and definitely that helps your mental health. Mental health doesn't suffer. You don't go into depression. There are suicidal attempts at this age. So do not go. Life is only once. I would like to say, हार जीत दोनों को भी acceptance के लिए यहाँ से ही आपका development जरूरी है. तो आयुर्वेदा ये सिखाता है सत्व, रज, तम. These are the mental factors we focus upon, and this suffers during menstrual period. And once you adopt the exercise of being cool and calm, definitely you can overcome, and this beautiful life can be carried away with good health. So another next point here is breast tenderness. तो ये होता ही है, इसमें कोई तकलीफ होने की बात नहीं. जैसे मेंसेस पास हो जाएगा, ये कम हो जाएगा. तो इसमें डरने वाली कोई बात नहीं है कि मुझे ये क्या हो रहा है. कि even if the clothes they touch and sometimes the girl has a pain. So this tenderness is because of the hormones in that period. So nothing to worry much. But if it is in excess, then definitely see a doctor. Now comes to menstrual hygiene. Here, I would again like, you may think I'm taking you in the backward area. Not at all, my friends. Now, ancient India had some culture, and this culture was from Vedas. Ayurveda is from Ved only. Now, Ved are nothing but a scientific institute, and this literature not only goes in health, it goes in warfare. Rigveda has all warfare, Rigveda has all the oblations, the mantras. Now NASA says, ओंकार करेंगे आप तो आपका rejuvenation होगा cell का. Okay, when the West says we accept. Then Samved is having all music in it. There are many other factors, but mainly it deals with music. Music is the best part of our system, where the nature and human being are always, they were always together. So when you hear to the sound of the sea, there is music. When you hear to the birds chirping, that is music. And these all are factors which are impining upon your brain for mental health, which we do not understand, and we let it out. We think only education and the degree matters. So this is not the case. So some way, then we go for the next Veda, where Germany during Second World War, they carried away this Veda. And you know, Germans are very strong with aircraft and automobile engineering, all those things from Vedas. So this all science has gone there. And we lost on Sanskrit. Sanskrit is the language, a scientific language. Now people accept it is the language of computers and very scientific. So we lost on that, and we lost on our culture also, because understanding matters, and the literature changes with translations. So this, and lastly, the Atharva Ved, where this Ved is having Ayurveda. Now, why I say? Because I spoke to you about Sattva Rajatama. When we talk about this, we in our universities, we do not talk usually about this. And definitely when the Western world is now high on this, they are coming up with these all ideals, more healthier ideals, with yoga getting a world platform. Nowadays, we know yoga is good. Was it not there 2000, since 2000 years? We did not popularize, only in pockets, only few people. So all these coming together definitely helps for a good, healthier society. Now, ancient India, we were talking about that. This was the background. I was trying to explain you that people were God-fearing. So people gave the name of religion, gave the name of festivities, and you should be performing the festival. And the prasad was particular. Come Ganpati festival. Because it is Pune, I would definitely like to talk about Ganpati. You all are aware of it. Definitely we go with prasadam, that is khobra and good. And the society was made in such a manner that everybody should get it, not one single. So we have this distribution of prasad. So this is nothing to do with religion. The coconut, dry coconut and good. And recently we finished Sankranti. Again, a social attitude, a women's festival where til and gur. Til, sesame, is a good source of calcium. Gur is a source of, jaggery is a source of iron. So see the prasad, the distribution to maintain general society health. It was not single. The science always aimed for health in the society. Now, another point, what we see in advertisements nowadays, why menstrual hygiene is suffering. See, we see a sanitary napkin advertisement with a girl running, jumping. I agree to the concept of sanitary pad. It has helped definitely. It has overcome so many issues of going out and sustaining and retaining and easy changing. All these things are good. But one thing matters. With the advertisement, the impining of the social media, the visual media is very strong on our minds. And definitely what happens, what you see, you think that is correct. That is easier. We can jump around, you can play badminton. But Ayurveda says we depend upon Vat, Pitta and Kapha. Vat is something to do with your activities. If you do more activity, Vat increases. Vat is air in short and central nervous system in large. Okay, so here your central nervous system, it suffers with your jumping. All these activities were refrained during menstrual cycle. People used to say you are not supposed to go out. Now, why a woman was not taken giving advantage of this? But with the society, we have to adopt some few things from there and few things from today's world. You definitely can go out if required. You cannot stop from working, but you cannot jump. In jumping, what happens? You can carry out the menstrual bleed will definitely not come out. It is helped by with your sanitary napkin. That is very comfortable. But once you jump, what happens? In this period is very weak period of the body or in a woman. And this will not cause any problem now. During the 40s, the uterus, the ligaments become weak and they start coming down through the vagina, which is called as prolapse. Prolapse of the uterus. and the uterus has to be removed sometimes, or it is a discomforting situation, minor operative procedure required to rectify this point. So do we want that? So initially they said, do not go out. So you are not supposed to go out with or carry out heavy exercise. You can go out with the sanitary napkin, but do not identify yourself that you can do vigorous exercise. So this is nothing backward. This is the science. It will come to us in more second decade, next decade, and then we say yes, yes, we will follow that. Once the interventions, once the research comes from the West, and definitely we start accepting. So we have to change this mentality when we have our own science, when we have our own culture, which was very strong, and some taboos we can remove and we can adopt as per the situation. So change the sanitary pads regularly. Now, what do you understand by this regularity? Regularly means if the bleeding amount varies from individual to individual. So 3/4 पैड जब भर जाता है तब डेफिनेटली चेंज कर दीजिए, और किसी किसी का 5 घंटे भी हो जाए लेकिन हाफ भी नहीं पूरा होता है, तब 4 घंटे के बाद डेफिनेटली यू हैव टू चेंज द पैड. Wash yourself regularly. Now again, taboo and today's world and ancient world, I definitely would like to discuss this point. Here what happens, bathing was not allowed for 4 days during ancient Indian times because there were no bathrooms, there were no such effects. But a scientific reason is once you take your bath, circulation occurs. You feel light and good with bathing, definitely. But here something which is in the uterus has to come out. With your bathing, what happens? That goes back into the circulation again. The metabolites which are not required has to come out, but they will go. But in India again, where there is so much of perspiration, and to maintain your health, you can definitely take a bath, but do not take a head bath. Definitely no head bath, because the pituitary gland is in your head. Okay, there are some hair hormones in this period with these points which are coming up in the research. You will definitely have an outcome. We are working on it. So bathing will be very faster, just to relieve yourself from the smell and the perspiration and cleansing the body. That's all. Okay, that makes the system weak. With I cannot explain you scientifically here, but definitely I would like to say bathing should be very fast, no head bath, clean your body, because India is a tropical country and definitely you cannot retain at that time. You can go in for bathing very fast and very, do not waste much of the time inside the bathroom, which will increase the work, and this in the longer run will cause many of the problems. Don't use soap. Now, in the vagina, there are some bacteria which are helping to maintain the pH in the vagina. pH is, now everybody understands, I suppose in 9th class we read pH of the blood, pH of acid, pH of alkaline things. So, whenever in the vagina there are bacteria which sustain in particular temperature, in particular pH. When you use soap, as we think dirt goes with soap, so we wash our hands or face with all the types of soaps. But whenever you are cleaning the vagina, always use warm water only. Clean the vagina with lukewarm water. Do not use soap, because the contents in the soap interact with the mucous membrane of the vagina. The bacteria are killed, and there starts the problem later. Okay, so this is a main thing which is to be followed as menstrual hygiene. Immediately after the clots come out, you need to wash the vagina regularly. Use the right washing technique. Now, what is right washing technique? Now, from front to back is the right technique. Do not touch the back side again to the front. Why? Because the anal opening is here and the vagina is in the front. So once the bacteria and the flora in the anal region are not suitable to the vagina, And the vaginal thing, even if they pass, we have a gap in between the vagina and the anal opening. Therefore, always do not touch the back of your hand in the front. What happens? You are carrying the infection from here to the vagina. And this is how the vaginal infections, the white discharge, all these things start. So that is the right washing technique. You have to wash from front of the vagina towards the back. Discard your used sanitary products properly. Why? Because many of us have this system now, flat system. We all will go on discarding it in a paper and then wrapping it properly and disposing in our flat, inside our flat. Again, that is a wrong thing, because blood attracts infection. I can give an example. Madam, do I have the time or do I need to stop? Can anybody answer for me? How much time do I have?
Oh, ma'am, last 10 minutes actually.
Okay, thank you. I'll wind up first. But I want to tell you this point, because many of us are doing this. If you have a cut on your finger, you see a fly going, but it will definitely come and sit on that. That is an example that the senses of the microbes and the lower vertebrates, invertebrates, they are very active. They can sense blood faster. So that is how the atmosphere in the house also gets vitiated. Therefore, always keep it outside the house covered, because the rats, the dogs, we know all those nuisances. So beware of a pad rash. Some people are very sensitive with the pad. As it goes on friction, once you go out, you are moving. With moment, the vaginal part and the pad, they go into friction. Once there is friction, if there is a sensitive skin, it goes into red rash. Or if there is an infection, a fungal infection catches up faster and becomes whitish, some dots come. Always use coconut oil, simple coconut oil, or along with camphor. And always go on applying, before applying the pad. Even if you do not have a rash, if you are sensitive, do apply coconut oil with camphor. That helps to avoid the pad rash, and all these 4 days, and after that for 2 days more. So 1 week total, apply the coconut oil. Have a bath regularly. Now, my friends, this is again a contradictory thing to what I have told. I have told from Ayurvedic perspective, and here it is from the modern side, wherein bath helps in tropical country. I do agree, for maintaining your general health, but do not waste your time, because your body is sensitive in this time, and our research is going on. I cannot tell you right now how this is going to harm. How to change sanitary napkins? Change at least once a day. Again, it is wrong. I have mentioned you once in 4 hours. I have mentioned you the bleed, how much it is soaked, and all these things. Do not keep it completely soaked for longer hours. Now, the disorders are irregular menses. If there is no menses, do see a doctor, because I told you, metabolite, our body is a dustbin. Every day we need to evacuate it by means of our fecal matter, urine. In the same manner, for a woman, the menstrual bleed has to go out. Once it is absorbed again in the body, you see obesity, you see some hairy attitude, you see acne on the face. So as I told, beauty is not only the heroine, but your own skin, how it is reflecting, how it is healthy without any acne. I don't go with laser and all. Your body should be naturally healthy. And this occurs if the dustbin is evacuated from time to time. And this is what I mean by irregular menses. If they don't occur, they are going to get absorbed. Obesity, thyroid levels increasing, all this giving rise to later in heavy periods, because the system goes again haywire. Scanty periods are again disorder thing, where anemic condition, if you are not eating properly, not sleeping properly, the anemic conditions are there, where if the body doesn't have the reserve of blood, it cannot throw out. That is also again a wrong thing. If there are heavy periods, Because of, if you have a good reserve, but there is heavy loss, again you will have issues. So you have, these all three things you're supposed to be mindful. Now today's problem is PCOD. Now the menstrual disorders are interconnected with this disorder also. Now, one point I would definitely like to impine. People say we are studying, so we are awakened at night. We too studied. Brahma Muhurta was the main thing, wherein your pineal gland is very active. So get up early in the morning. Your skin will be problem. Your motion will be problem. Once the dustbin is evacuated, your system is active. You feel good hunger. People say 8 hours sleep. They kept in mind. We sleep at 1 o'clock. We are 2 o'clock. We get up at 10 o'clock. 8 hours sleep. No, my friends. This is going to put pressure on the thyroid. This is how many of the women are taking thyroid tablet now. So you're putting pressure on the system, right from the hormonal system to the thyroid. You're spoiling one organ and you're not mindful of it by keeping yourself awake with all mobiles. All, please stop this. I want young India, young women to be healthier. So be mindful. You sleep at 9, 9:30, 10, and you get up around early morning by 6 at least. Our system starts with sun, rise and sunset. It goes down. So better be studying early in the morning when your glands are active, the retention capacity, the nervous system is active. So you have to improve on your diet, fresh diet. We go with samosas, again we go with your microwave, that is very harmful. Simple food, varan, bhat, bhaji, podi, koshimbir. What we have in Maharashtra, we have in Gujarat with some chanch, takra, not dahi. Chanch is the thing. The buttermilk is very nutritious and this helps. Definitely have 1 spoon of til mostly until it is cold season. Later on, once the autumn goes, spring comes, stop that and have as much of fresh food. The kokum is available in Pune and buttermilk is the best available option in across India. And do have all the things. Please avoid junk food. You have a cheating day once in a month is fine, but do not think आज मैंने खाना बना लिया या समोसा तल दिया, वापस तला या वापस गरम किया. The vitality of the food is lost in half an hour. So mindful कि खाना बन गया, तुरंत गरम food खाइए. Regular exercise, sports कीजिए, लेकिन definitely regular exercise क्यों? तो because women used to work much at home. Before, people used to be pitying कि ladies को बहुत काम होता है. अरे, your shape, your size was mindful. We are sitting on the bed, we are sitting on the chair. Do sit down and get up. So that is a pelvic exercise. So this you should be mindful. With all the amenities of today, we are into definitely, we are progressive, but उसके साथ ये सब चीजें lacking हो रही है. Positive attitude towards life. Always be positive, be happy. So all these rag, lobh, krodh, matsar, jealous, please avoid all these things. You will be very happy. Do vyayam and do pranayam. Definitely spend time for meditation. Say Onkar 11 times in the morning, 11 times. I'm just talking in general. This is nothing to do with the religion. Those who can, please do it. Those who cannot, at least sit for few minutes in meditation pose and make your mind to absolutely into silence mode. So thank you so much. And any interactions, if I have time, definitely I'm open. Namaskar.
Thank you so much, ma'am, for your variable guidance. Participants can write their questions in a chat box.
Any questions? Then I'll take it either you have understood everything or I missed out something.
I think no question is there.
Okay. So I can take leave then.
Ma'am, I would like to have a question.
Sure, sure.
Ma'am, about the sanitary pads, as you have said about the how to dispose it, I want to ask, like while disposing it, it should come under biodegradable or non-biodegradable?
Biodegradable, of course.
Okay, ma'am.
Because environment, we are contributing, we are responsible for the environment, and definitely we should be doing that in a responsible way. Tampons and menstrual cups, yes, we have had this. I think I would definitely like you to be using with the napkin only. Do not try pushing, because sometimes there is irritation. Only when you are traveling, then you can use with tampons. Those who are married, I will not advise for the rest of the girls. Okay. Anything retained in one place in unhygienic. See, if your sink clogs, it smells. Your dustbin is not evacuated, it smells. Once you are not going to the motion, definitely the gaseous problems will be there, it smells. Therefore, it is unhygienic. Dispose of first, that is hygienic. Yes?
Am I audible?
Very slow, beta. Come out in a bit louder.
Yes, ma'am. Ma'am, I wanted to ask, can Ayurveda help in curing or controlling PCOD?
Definitely, Ayurveda helps. Why I am telling you, we set out your lifestyle only. Medication to some extent, 2 months. But PCOD starts recurring. It is recurring if you do not maintain a proper lifestyle. Sleep at the right time, diet right time, whatever region you are coming from. You are supposed to take that staple diet, and as per the region where you are staying, both. So this is how I would like to advise you. Definitely Panchakarma is there, Basti treatment is there. It does help you. Definitely PCOD can be overcome by lifestyle modification. Is that all?
Good afternoon, Seema here.
Good afternoon.
Ma'am, I just wanted to know your view on how this concept came in ancient history also, that the women cannot be a part of any religious activity, or cannot go to temples, cannot perform puja or any other activities which are related to God. So I just wanted your view on how this concept came into picture.
Okay. Oh, very nicely told. The question is rightly asked, Seema, and it's really very nice to know about this progressive thing. It was like this. I'll tell you. Whenever a woman bleeds, as I told you, always there is a scientific concept behind a cultural event or a social thing, what was advocated in ancient India. As I gave this example, if you have a cut on your hand, definitely you will have a fly coming to it. Okay, they are more sensitive. So when you're bleeding, in those days, there was no napkin, only the cloth was used. And some people were deficit of that also. So when there was movement, they were not allowed in the kitchen. See the scientific attitude, so that the health of the rest of the members is procured well. And the bleeding will attract many infections, many microbes. So the woman was confined to one place. Temples, of course, are an energy source, energy of purity, energy where social gathering takes place. Understood? When the woman was given a single room, was confined to one corner of the house, the idea was this: the microbes should not be prevailing in the entire house. They should be refrained in one place. And as such, women, while bleeding, we have abdominal cramps, we are weaker at that moment. As the blood is going out, by law of physics, matter, everything, three matters, liquid and air and liquid, gaseous and solid. So once the blood comes out, gaseous entry is there. That is, Vat becomes more. The woman is more weaker in Vatic avastha. and that time she requires rest, and that is how she was refrained from movement. In those days, early marriages, the girl's age was around 8 to 11. She would not understand anything, and once she goes to her in-laws place, more of work. Nobody cares you as a mother cares you. So the system, social system was such that once she sits in one place, she can get some rest. That was one view, and this is how they were refraining. One was a scientific view of micro spreading, cleanliness, hygiene, and second view was rest to the woman. This is according to me. I hope.
Well explained, ma'am. Thank you.
Thank you.
Thank you, ma'am. Now I would like to call Open Assistant Professor Vinita ma'am for vote of thanks.
Thank you, Oksana.
Thank you.
Yes, thank you, Oksana. Good afternoon, everyone. Good afternoon, Neeta ma'am, Dr. Neeta ma'am, Principal ma'am, and all the participants of today's program. On behalf of Dr. D.Y. Patil, Unitech Society's Dr. D.Y. Patil Law College, Pimpri, Pune, I express my sincere gratitude towards our today's guest speaker, Dr. Neeta Mahesekar, for your valuable guidance and enlightenment on the topic to our students and even us also, ma'am. Ma'am, you have guided the participants in very simple and plain language. Otherwise, medical language is actually very tough. Ma'am, you have guided the student from how our daily diet affects on menstrual cycle till the how we have to wrap the use pad, right? So, ma'am, very thank you for that, ma'am. And we know from your very busy schedule, you have taken time for us. Thank you, ma'am. Thank you so
I'm
much.
also happy I could serve my institute back again. That was an honor. Thank you.
One announcement for participants. For this session, feedback form link is given there in the chat box. So kindly fill the feedback form.